Over the course of a long career in emergency medicine, something becomes clear that no textbook ever quite captures. It's not the dramatic moments that stay with you, not the rushing gurneys or the urgent calls over the intercom. What stays with you is the quieter realization that almost everything you're treating could have been caught years earlier, decades earlier sometimes. The patients who come through those doors with serious cardiac events, with strokes, with failing kidneys or dangerous blood sugar crises, the overwhelming majority of them are past the age of 50. And that part isn't surprising. Bodies age. Systems wear down. That's just biology. What's harder to sit with is the realization, after reviewing their history and running the numbers, that whatever brought them in had been quietly building for 5 years, 10 years, sometimes longer. Not hiding exactly, just never measured, never tracked, never caught. Modern medicine has achieved genuinely extraordinary things. The procedures available today, the medications, the imaging, the surgical interventions, they are nothing short of remarkable. But the system that delivers all of that brilliance is, by its very nature, oriented toward crisis. It responds. It reacts. It treats what has already gone wrong. What it does far less well is notice the slow drift toward disaster while there's still plenty of time to change course. And that gap between what medicine can do and what it routinely does is where so much preventable suffering lies. The body is not unlike a complex piece of machinery that runs continuously, without pause, for decades. The people who maintain that machinery well, who pay attention to small changes, who monitor the baseline, who address minor issues before they compound, tend to keep it running far longer and far more reliably than those who only seek help when something has already broken down badly. This isn't a metaphor meant to reduce the human body to something mechanical. It's just a way of making the point that regular monitoring isn't about anxiety or over-medicalizing your life. It's about giving yourself the earliest possible warning when something starts to shift, while the window to act is still wide open. Here's something else worth understanding. Most of the patients who end up in serious trouble didn't simply feel completely fine right up until the moment everything changed. Many of them have been experiencing something, a persistent fatigue that felt different from ordinary tiredness, a slight breathlessness during activities that never used to wind them, a subtle haziness in their thinking, strange sensations in their hands or feet that came and went. The problem is that when symptoms develop over months or years rather than hours or days, the brain adapts to them. They stop registering as warning signs. They become the new normal. And because each of us has only ever lived inside our own body, there's no reference point, no other version of yourself to compare against. You don't know whether the energy you have at 55 is simply what 55 feels like, or whether it's the quiet signal of something that's been wrong for years. So what is actually showing up in the tests when these patients arrive? What are the numbers that paint the clearest picture of what's been developing in the background? There are a handful, and none of them are complicated, expensive, or particularly difficult to access. The first, and the one that tends to surprise people most when they understand what it's actually doing to the body over time, is blood pressure. It carries the reputation of a silent killer, which sounds dramatic until you've spent years watching what sustained elevation actually does to a person in their 60s or 70s. The reason it's silent is that it genuinely doesn't produce any sensation. The arteries are under greater pressure than they're designed to handle, day after day, year after year, and they respond by thickening and stiffening. The heart, now working harder than it should to push blood through those stiffer vessels, gradually enlarges and strains. The delicate small blood vessels feeding the brain, the kidneys, and the eyes begin to sustain damage that accumulates invisibly over time. And then one day, sometimes with no warning at all, something gives way. A vessel in the brain ruptures or closes off. A heart that has been quietly overworking for a decade begins to fail. A kidney that has been struggling under the pressure for years tips into serious dysfunction. These are the patients who arrive through emergency department doors. And when you look at their records, blood pressure readings above the healthy range have often been there for years. Sometimes the problem was known and inadequately managed. Sometimes it was never measured at all. A home blood pressure monitor, available for a modest cost at any pharmacy, gives you one of the most valuable numbers you can know about yourself. A consistent reading around 120/80 or lower is what you're aiming for. Anything that regularly sits above 130/85 warrants a serious conversation with a doctor, because even modestly elevated pressure, sustained over many years, causes real and significant damage. Running alongside blood pressure as an equally overlooked indicator is resting heart rate. Most people don't think about this number much, but a resting heart rate that consistently sits above 80 beats per minute, certainly one above 90, is a meaningful signal. It can reflect a cardiovascular system under strain, a nervous system locked in a low-level state of chronic stress, or underlying metabolic disruption. For most healthy adults, a resting heart rate somewhere between 50 and 70 beats per minute is where you want to be. Elite endurance athletes will often sit lower, sometimes in the high 30s or low 40s, which can occasionally cause unnecessary alarm when they turn up in the emergency department with an unrelated injury and every monitor in the room starts flashing. But for the general population, a consistently elevated resting rate is a signal worth investigating. You can measure it right now, without any equipment, by pressing 2 fingertips against the inside of your wrist, feeling for the pulse, counting the beats over 30 seconds, and doubling that number. A fitness tracker or smartwatch will give you a running average over days and weeks, which is even more informative than a single reading. Kidney function is the third area that deserves far more attention than it typically receives outside of medical settings. The kidneys are doing an enormous amount of work at every moment, filtering the entire blood supply repeatedly throughout each day, managing fluid levels, regulating blood pressure, clearing waste products. They are also remarkably vulnerable to sustained high blood pressure, chronically elevated blood sugar, chronic inflammation, and certain medications. What makes the situation particularly difficult is that the kidneys are exceptionally good at compensating for damage. A substantial portion of kidney function can be lost without producing any noticeable symptoms. No pain, no change in how you feel, nothing that would prompt most people to pick up the phone and call their doctor. Patients arrive through emergency departments with what looks like an unrelated complaint: nausea, confusion, unusual breathlessness, and a basic blood test reveals that kidney function has declined severely. Reviewing their prior records, the decline was often visible in previous blood work, progressing slowly and steadily, never quite crossing the threshold that prompted meaningful intervention. A test called eGFR, estimated glomerular filtration rate, is the standard measure of how well the kidneys are filtering, and it's part of any basic blood panel a doctor can arrange. It's also available privately if access through standard healthcare channels is difficult. Getting this checked once a year, especially for middle age onward, is genuinely worthwhile. Cholesterol and triglycerides represent another piece of the same puzzle, one that has attracted a great deal of confusing and sometimes contradictory conversation in recent years. What the research consistently supports is that chronically elevated LDL cholesterol and high triglyceride levels are meaningful contributors to cardiovascular disease over the long term. They are part of the process by which fatty deposits gradually build up inside artery walls, narrowing and hardening those vessels over years and decades until the risk of a heart attack or stroke becomes very real. There are no symptoms. There are no warning sensations. Elevated cholesterol does not hurt. Raised triglycerides don't announce themselves. The damage is entirely invisible until the consequences appear, and by then, the process has often been running for a very long time. Both of these can be measured through a simple, inexpensive blood test that most general practitioners can order without any special referral. Blood sugar, measured not just as a single snapshot, but as an average over the preceding 2 to 3 months through a test called HbA1c, is perhaps the number that most people underestimate, and also the one where lifestyle choices have the most immediate and powerful influence. In emergency settings, elevated blood sugar turns up frequently, often in patients who didn't know their levels were high, and sometimes in people who had been told but hadn't fully understood what the long-term consequences of chronically raised blood sugar actually looked like. When blood sugar runs consistently above the healthy range for months or years, blood vessels sustain damage throughout the body. Nerves begin to be affected. The kidneys are placed under additional strain. The heart and circulatory system bear the consequences. The healthy threshold for HbA1c sits below 42 millimoles per mole in British measurements, or below 5.7% in American ones. And genuinely, the lower within the healthy range, the better. Regular walking after meals, a diet rich in fiber, protein, and whole foods, and reducing refined carbohydrates and added sugars can all move this number meaningfully in the right direction. It's one of the most modifiable markers on this entire list. The final indicator worth monitoring is liver function, specifically the enzymes that leak into the bloodstream when liver cells are under stress. The most common reason these markers come back elevated in the general population today is fatty liver disease, which has become increasingly widespread as dietary patterns have shifted and physical activity has declined. The liver accumulates fat in response to excess sugar, refined carbohydrates, alcohol, and insufficient movement. This doesn't hurt. It produces no noticeable symptoms. The liver just becomes gradually less efficient, more inflamed, and more compromised in its ability to do all the things it's responsible for, which include regulating cholesterol, managing blood sugar, processing hormones, and metabolizing medications. A damaged liver affects virtually every other system in the body, which is why this marker, as unglamorous as it sounds, matters enormously. Elevated readings on a liver function test, particularly the enzymes known as ALT and AST, signal that something needs proper attention, which means a thorough clinical assessment and likely some imaging, typically an ultrasound, to understand what's happening beneath the surface. What connects all of these markers is something important. None of them exist in isolation. A raised resting heart rate might be pointing toward poor cardiovascular fitness, chronic stress, or disrupted sleep. An elevated HbA1c is almost always reflecting dietary patterns and activity levels. High triglycerides often tell the same story. Declining kidney function frequently traces back to uncontrolled blood pressure or blood sugar. Abnormal liver enzymes point directly at metabolic health. These signals are part of an interconnected picture, and when you start looking at them together, tracking them over time, noticing shifts before they become crises, you gain something that no amount of reactive medicine can give you: time. Time to change course. Time to make different choices. Time to address a problem while it's still genuinely addressable. None of this is meant to create anxiety or to suggest that every reading slightly outside the optimal range represents an emergency. It doesn't. What it represents is information you can act on. The people who tend to live the longest, the healthiest, and the most independently are not the ones who spent the most time in doctors' offices or hospitals. They're the ones who rarely needed to be there, because they caught the small things while they were still small. They paid attention to the numbers before the numbers became a crisis. They understood that the body gives signals long before it gives emergencies, and they learned to listen. The technology to do exactly this is available right now to most people at relatively low cost. A blood pressure cuff, a basic fitness tracker, an annual blood panel that includes kidney function, liver enzymes, blood sugar, and cholesterol. These are not extravagant investments. They are, in the most literal sense, the difference between knowing what's happening inside your body and finding out the hard way when it's already too late to prevent serious damage. The choice to monitor, to treat your own health with the same consistent attention you'd give to anything else you care about maintaining, is one of the most meaningful decisions you can make. Not because something is necessarily wrong, but because if something does start to shift, you will know about it early. And early is everything.